We'll talk about Chuck Therapy. Health and Human Services Secretary Kathleen Sebelius calling out the Republicans' plan to deal with Medicare and taking scare tactics to a new level. I want you to listen to what she said, or actually read what she said. If you run out of the government voucher and then you run out of your own money, you are left to scrape together charity care, go without care, and die sooner.
The Democrats continue to use these scare tactics, and it's at a point where I find I'm very resentful of it.
Well, if you're going to say we're not going to cut entitlements, that's like saying we're going to go bankrupt as a nation.
Talk about scare tactics. Well, we know that the Republican leadership has apparently already punted on the Ryan plan's attempt to dismantle Medicare, but some Democrats are going in the opposite direction, with legislation introduced today in both the Senate and the House to extend Medicare to all. The American Health Security for All Act. Joining us to explain what's in it and why he's not scared, the Senate bill's sponsor, independent from Vermont and regular Grit TV commentator, Bernie Sanders. Senator Sanders, welcome back. These scare tactics are not working on you. Don't you hear what's being said? If we don't scale back, we are going to die, I think, and, well, bankrupt the nation.
Well, let me tell you what is happening. This is not a scare tactic. This is a fact. This year, according to a study at Harvard University, we're going to lose about 45,000 Americans. They're going to die because they don't get to a doctor when they should. Millions of people are going to be suffering unnecessarily because they don't have health insurance and they don't have access to primary health care. My view, and my view has been this for many, many years, is that the United States of America has got to join the rest of the industrialized world and guarantee health care to every man, woman, and child as a right and not a privilege. And Laura, here is what is interesting. At a time when we have 50 million Americans who have no health insurance, many more who are underinsured, we end up spending almost twice as much per capita on health care as do any other nation. And on top of all that, our health care outcomes in terms of life expectancy, in terms of infant mortality, and other indices are lower than many other countries. We've got a dysfunctional system, and it's dysfunctional because the goal of private insurance companies is not to provide health care to all people in a cost-effective way. It's to make as much money as they possibly can. So we end up spending about 30 cents of every dollar on administration, bureaucracy, and profiteering rather than on delivering health care.
And how much do they make?
Oh, insurance companies do very, very well. Drug companies end up charging us the highest rates of any country on earth. They sell the same product in the United States, in some cases, for twice as much as they will in Europe or in Canada. Private insurance companies distort health care because keeping people healthy, disease prevention, primary health care access is not a way you make a whole lot of money. So we have a system today that is in many ways dysfunctional, extremely wasteful, extremely expensive, and a Medicare for all system administered at the statewide level could provide health care to all people in a much more cost-effective way.
So talk to us about how this would work. The American Healthcare Security for All Act, as you just said, it's a federal program administered at the state level. Explain that for me.
Well, what you have is you have federal standards, but you're giving flexibility to states with the understanding that a small rural state like Vermont is different than a state like New York State or California. So you're going to give people flexibility. But the program, importantly, is administered at the state. And why that is so important, I think, is that people have more access to their state legislature about what should be covered, what should not be covered. And they can get into that process much more effectively at the state level than they can at the national level.
So how does it work for people?
It works for people is that we're all in it together. That instead of having 10 different insurance cards in a given state, you have one. In the state of Vermont, it'll be the Green Mountain card. You can go to the doctor that you want, you go to the hospital that you want, and there will be one single payer paying the costs. When we do that, we're going to save substantial sums of money in doing away with a lot of bureaucracy and administration, a lot of waste in billing. We spend billions of dollars a year as a nation arguing about whether we're covered or we're not covered. when you are covered and your healthcare dollar goes into healthcare, you save a whole lot of money.
And how about costs? I mean, we may save, but in terms of the costs themselves, do they actually come down? And how?
They sure do. Well, different studies may show different conclusions, but the bottom line is certainly in terms of per capita expenditure, costs go way, way down because you do away with a whole lot of bureaucracy inherent in a multi-private insurance company system. So the savings are enormous. They will be enormous in Vermont. We have seen in Taiwan, for example, which moved from an American-type system to a single-payer system. Their administrative costs went way, way down. In that country, you walk into a doctor's office, you give him or her your card, your payment is instantaneous. You don't have to go through a whole lot of billing process. It saves significant sums of money.
But are you still dealing with for-profit companies? I mean, is the state or the federal government still dealing with those companies that right now are making the
not for basic health care, no. The United States is the only country today that allows for-profit insurance companies to actively participate in their healthcare system. And that is the reason why our costs are so much higher per capita than any other.
So two things. One, why is this different from Vermont? Here's Vermont's Vermont's governor talking about what's happening there.
How do you intend to survive under the existing system? Costs are going up at twice the rate of inflation. We've watched in this little state in the last 10 years, we're spending $2.5 billion more on health care, our little teeny state, than we were 10 years ago. Costs are going up $1 million a day. We've got to reform it. If Vermont gets this right, we will be the state that has quality health care, that grows jobs, and that has great economic opportunities.
Vermont says they're doing it anyway. You know Vermont.
I sure do know Vermont. No, and my hope is that Vermont, in fact, will lead the nation in that direction. But I want to see the whole country have that opportunity to follow Vermont.